Hi, this is Dr. Parth Patel, and this being my last day of my fellowship at Gulani Vision Institute, I was told to make a small video of my experiences here and sort of a behind the scenes experience. So to start off with, let me say that the first day I walked in here, I was truly impressed and a bit skeptical. But now being my last day, I can proudly say I'm really and truly inspired with everything that I have learned here. What impressed me the most was the fact that there were patients who were flying in from all these different places, and yet there was this positive atmosphere and friendly atmosphere that's maintained here by Dr. Gulani and his staff. The staff here was very courteous, they were very helpful. I saw this full spectrum of complicated cases which were corrected with excellent vision. And with the ease with which it was performed, that was primarily what impressed me the most, because all of these complicated patients were sat with and they were educated, and I felt so many times Dr. Gulani walked the tightrope where they were really educated patients who expected a lot in terms of outcomes, but he just made it sound really easy. There were a lot of myths that I had heard during my residency which I saw broken here during my period here. For example, PRK, which we were taught, was always very painful. In my time here, I didn't see any patient complaining of pain. The mild discomfort here and there, but no one actually complaining of pain, even though I asked them, I took interviews and put them on my blog too. I would say this experience has been really rewarding for me, and this whole practice that Dr. Gulani has set up, which is more result based and patient centric rather than being a slave to technology, is what I wish to carry forward. I'm lucky to have found a mentor in him, and I hope I can carry that forward in my career.
So Parth, you're finishing your fellowship here and heading back to start your own practice. I think it'll be wonderful. You learned a lot of stuff here. You have the diligence, you worked hard, you were there to watch the surgeries, the patient interactions, the administrative concepts that I believe in, and I think you will carry that very well with you. So biggest thing I can teach you or explain to you is the attitude. Attitude that you must fight for every patient's vision. Treat them like family. Never give up. Always be elegant, an artist. Don't just do surgery for the heck of it. Don't chase money. That'll always follow you. And inspire people. That's it.
Thank you, sir. Actually, I really appreciate the whole opportunity that I got, because I've never had anybody to guide me before, because I come from a non-medical family background, and I felt obviously I would have learned ophthalmology somewhere else, but the whole package of, like, obviously, you know, the soft skills, the marketing, the attitude, the approach, and I'm really lucky to learn it from you, someone who's so successful in the field. So I'm really happy, and I hope I can follow the same thing and then apply it to my life and my practice.
Sure, I'm sure you will. Again, what you saw here is there is no marketing, there is no advertising. But once you connect with the patients as a human, you see how they spread your passion themselves. And that's the cycle that you see here constantly. True. Families bringing their families from all over the world. No advertising going on, there is no deals, no gimmicks, no discounts, nothing. Everybody else advertises, but you're just seeing patients fly in, fly out. So I truly believe it's treat them very well, focus on them. Do not worry about what you need, think about why they are there, and perform. You've seen me in the surgical center where doctors are rushing in and out. But you go and focus, make sure you meet the family before surgery. Make sure you meet them after the surgery. Never forget that you're working on someone's mother, brother, sister, not an eyeball. So these are important aspects that I hope you've learned, besides the surgical skills of how we turn every patient to excellence, because that drives excellence. The day you get cocky, the day you start thinking, you know, this is great, everybody's coming for you, things go down. Never forget that. So every day what you've seen me do here, again, prepare for them, stay back at night, make the plans for the patients. Don't just show up in surgery. So that's very, very vital. As long as you carry those principles, it doesn't matter where you practice.
Yes.
You'll be superb. And never worry about competition, because competition cannot happen to you if you're passionately so high. And you never have to worry about who's where outside your window, which doctor practices. It doesn't matter. Focus on that patient who's right there in front of you. You want to perform and give them everything. The rest happens. Right?
Yes.
So do that. You'll do wonderful. Congratulations again.
Thank you.
Safe trip back home.
Yes.
Okay? Take care.